Okay, so for the first 15 minutes, what I've done before is given her a little bit of breath work and some specific remedies to expand the body and open up the connection where she has resisted feeling something in her body. It can sometimes be called a conflict energy. Now that she's friendlier with it and more present with it, the neck muscles are softened, and there's an action in Cranial Sacral called unwinding, where there's a pathway and the energy can find the direction and unwind. So I always refer to any process as having a PhD of healing, being present, harmonizing, and then directing the energy where it needs to go. And so this is a craniosacral technique that helps direct the energy out through her spine and her spinal channel. And because the spine carries a charge of energy that is often very strong and a charge that we can't handle, this takes it neutralizes the charge and allows her to release it. And that's actually what we call a release, is something that was tight and bound up in us, and through some action becomes freed up and unburdened. All right, so the next step is to free up the jaw. Jaw tension is so much part of resistance and stress, and this is a craniosacral hold that allows the muscles around the TM joint, temporomandibular joint, to release. There's a certain direction, and in this one it's longitudinal, and the muscles release towards her feet in that direction. A lot of the work that is done is really not seen by an observer, and it seems as if I'm doing nothing, but I'm actually holding that connection with her and following it all the way through and noticing the rhythms and the ebb and flow of the release. It's very important to wait and get a full release and honor the process. My next hold is addressing the sphenoid bone, which is like a little butterfly bone across the face, and it creates the cheekbones. And it's attached right at the center behind the nose. And often there's compression and stuckedness, so it doesn't have the mobility it should. And I'm just helping it loosen up. So I use the bones on either side like little handles where my thumb is attached, and I'm prompting a motion. This is a craniosacral motion that facilitates the release again of a stuck area of restriction. And it's so important for her to have that flow again in her head area, around the mouth, around the teeth. Now we're going to the parietals, which are the bones just above the, on the side of the forehead, above the jaw. And I'm noticing that the body is already doing a lot on its own, and I'm just following it. It's a very intelligent body, and it's done this before, and it knows exactly how to release. And what wave to engage. And this is a wave that comes towards the center and then outward. And then it releases towards the head, towards me. And that's the way the muscle moves to release itself in this area. The parietal bones are often tight in many headaches, migraine situations. Okay,